Afternoon. I'd like to welcome you to this Plymouth COVID-19 update number 10. We're coming to you live from PACTV studios. It is March 27, 2020, and we're beginning at noon. I'd like to welcome all of you. My name is Steve Triffletti. I am the Plymouth Town Moderator. We'd like to invite our viewers to ask questions by emailing us at plymouthInfo@pactv.org. And today you can also watch us live on Comcast channels 15 and 13, Verizon channels 47 and 43, or you can stream online live on pactv.org. We have quite a lineup today. Once again, we're joined, as we always are, with Kenneth Tavares. He's the chair of the Plymouth Board of Selectmen. He's joined by Melissa Arrighi, our Plymouth Town Manager, and she's joined by Roxanne Whitbeck, who is our Veterans Agent. Also, Dr. Philip Triffletti, who happens to be my brother. He's an attending physician at Beth Israel Deaconess. Danielle Fusco, she is the Regional Clinical Specialist with Plymouth Rehab and Healthcare. Amy Naples from the Executive Director of the Plymouth Area Chamber of Commerce. Brian Fitzgibbons, the Order Local Project, and Matt Muratore, as always, is our Plymouth State Representative. We're going to go right into our town update with Kenneth Tavares, Chair of the Plymouth Board of Selectmen. Welcome, Ken.
Thank you. Good afternoon, everyone. It's a pleasure to be back again today. A few days ago, I talked about the rumor mill, and it is alive and well. So we really appreciate everyone tuning in to get the correct information. What I want to do today, because we have a busy program ahead of us, is really send a shout out and a thank you to the Governor of the Commonwealth. He just finished an extensive briefing. It was extremely helpful. He's making the right decisions. And as a local official, I appreciate guidance that's coming from Beacon Hill. With that, Steve, I turn it back to you.
Thank you, Ken Tavares, Chair of the Plymouth Board of Selectmen. And now we're going to Melissa Arrighi, our Plymouth Town Manager. Welcome, Melissa.
Thank you. Thanks for having me. So there's a couple things I'd like to touch on today. One is the partnerships that we're having with so many people. You keep seeing commercials say we're all in this together, and that's absolutely correct. We have worked closely with PACTV, as you can see today, WATD, Old Colony Memorial, the Chamber. Thank you to Amy for getting back to me so quickly and being such a great partner in this. Leah Filson, we've included her for See Plymouth so we can get some information out to tourists. Our seniors, working closely with the Senior Center Director who's been on the show, Michelle Brady, as well as using our town Facebook page and our website really extensively during this time. And I encourage people to go there. Later in the show, I'd also like to talk a little bit on communication and how we're trying to do that and the help we could get from the public on that, as well as good practices that we should be doing at home to flatten this curve we keep hearing about. And finally, I'd like to touch on staff availability. We are here, we are working, we're serving the public, and we want to be able to continue to do that. We have better plans in place every single day to do that. So anything our residents need, we're accessible.
Thank you. That is Melissa Arrighi. She's the Plymouth Town Manager. She mentioned about communication. Selectman Tavares mentioned about rumors. One of the reasons that we're doing this daily update is to provide you with verified information from trusted sources, authorities, and experts. And now we're going to go to Roxanne Whitbeck, who is the Veterans Agent in the town of Plymouth. Welcome, Roxanne.
Good afternoon. Thank you for having me. I guess my message really is to reach out to all my veterans that most of our veterans are senior and they're not tech savvy, but just to hear a voice that is reassuring and we're right here. I just want to put my cell phone number out again in case anyone just wants to chat. It's 508-726-7456. And I am here all the time just to take your call and just to reassure you if I can. We're doing everything that we can. If anyone is in need of anything, please call me. I'll do my very best to get whatever I can. Like I said, I was out this morning delivering meals and I'm going to do one more this afternoon. But if anybody needs anything, just call me and I will be more than happy to come by.
Thank you. That is Roxanne Whitbeck, and she is our Veterans Agent. Next, I'm very pleased to introduce my brother, Dr. Philip Triffletti. Roxanne, he happens to be a veteran from the Air Force. And for
Yay.
all of you,
Thank you
he
for
grew
your
up locally. He attended church in Plymouth. He lives on the South Shore. And his administrative responsibilities in the past have brought him to the Plymouth campus at Beth Israel Deaconess. Phil, welcome.
Thank you very much, Steve, for having me on your show this afternoon. What I've done is I've prepared about a 10-minute summary of what I think are the most important things for people in the community to be aware of with the COVID-19. And is the sound coming through okay?
Yes, thank you.
Okay. So the first thing I wanted to do, I took a poll in my house and talking to some patients, and I put together a list of items, questions that came up. And so one of the questions is, what type of symptoms would people have with COVID-19? And it turns out about 90 to 100% of people would have fever. And usually we're talking about fevers 100.4 or more. So fever is probably one of the most important symptoms to be watching for if you or somebody around you is worried about being sick with the COVID-19. Fatigue is very common, 70%. Cough, about 60%. Shortness of breath is probably going to occur more in seriously ill patients, and that's only about 30%. And then there are a smattering of other types of symptoms people might have, which are not as common. They could be sore throat, headache, nausea, vomiting, diarrhea, not as common. The main things would be the fever, the cough, those shortness of breath. Those are the main things that we're watching for. I was asked, is this an airborne virus? That's a very important question. It's, as best we know, it is not, technically speaking, an airborne virus. Measles is an example of an airborne virus. And if somebody had measles, active measles, and was in the room with you, the virus particle would float around for about 2 days. That doesn't happen with this. This is the same as influenza or other types of common cold viruses. It's spread by a respiratory droplet. So that could be, some mucus that comes out when you cough or you sneeze. It could be transmitted by kissing. So that's the way it spreads. And it doesn't appear to be floating in the air. And I know that that's been a concern of some people. What are some of the risk factors? You've probably heard about this. The main one really is age. And so the people who are most seriously ill and most likely to die from this are people over the age of 80. And, the death rates decline if you're in your 7th decade or your 6th decade. Obviously, if you have problems like chronic lung disease, heart disease, diabetes, cancer, all those things increase your risk significantly above what it would be for a younger, healthy person. I've had questions about what to do about handling packages at home. And it turns out that on cardboard, the virus can last for up to 48 hours. On plastic packages, you receive up to 72 hours. And so one recommendation is to not handle those packages for a period of at least 24 hours, but longer if you wish, to let anything dry up that might be on the package. Or alternatively, you could clean it with a sanitizer and you could handle the packages immediately. Their question has come up about asymptomatic, meaning the person has no symptoms. And, we don't have all the information on this virus that we want, but coming out of China, it appeared that maybe up to 15%, 15 out of 100 people, might have not had symptoms when they first were shedding virus. Most viruses, the main period where you're shedding virus, and that means when you're contagious to infect other people, it usually does coincide well with when symptoms start. So I think as a basic guideline, you could still consider that, the main thing to follow is that most people who are well are probably not going to be infected with COVID-19. But once symptoms occur, then that's when people can be contagious. And the average incubation period is actually been measured in China to be about 5 days. So that means a person, if they were exposed to COVID-19, it might take them 5 days to start to feel sick. In some cases, it could happen maybe as soon as 2 days. and most people would be sick by 11 days. And that's part of where that 14-day quarantine number comes up, is we feel that would really, cover just about every case. If people were self-quarantining for 14 days, you wouldn't have to worry at the end of 14 days. If you hadn't gotten sick by 14 days, things would be fine. My physician actually sent out a notice to all his patients, and he had recommended as a resource, a general resource for the public, cdc.gov. And that's a mainstream, I think a very informative, scientific-based resource. So I think, a lot of times when people go online, you might get information from all kinds of sources, but, I would advise people to try to stick with the most credible resources like the CDC. So that would be my recommendation as well. A lot of people probably wonder about wearing masks. And so I reviewed recently just to see if there's any change and update for the use of using masks. And of course, healthcare workers who are dealing with these sick patients, obviously they need to wear masks to protect themselves. However, for the general public, it's still the same recommendation that, when you're out about, you don't need to be wearing a mask. Obviously, we want to have social distancing at a distance of about 6 feet, because respiratory droplets from a person could carry up to 3 feet. So 6 feet is a nice, safe distance. But people don't need to wear masks out in public. The hand washing is really still absolutely the most important thing to do. So if you go out and you're going to be touching items, doorknobs, door handles, you want to have a sanitizer with at least 60% alcohol. If you have a sanitizer available, I realize they're hard to come by. You want to wash your hands after, touching items outside the house, and certainly before you return into your own home. So the masks really are most important to be put on a person. If a person were sick and had to leave their home, we'd want them to have a mask on so they're not spreading respiratory droplets. If you were living with somebody who was sick and you were either elderly or had some immune system problems, that would also be a good idea to wear a mask if you're in the same household with somebody who has COVID-19. But otherwise, masks wouldn't be required. I did attend a lecture on video yesterday at Beth Deaconess Medical Center, and they had collected a lot of the expert scientists from the Harvard community, and they were discussing about medications, what could be used to treat the virus. And right now they quoted about 136 studies that are going on worldwide, looking at a variety of things such as antiviral drugs, the antimalarial drugs people may have heard of, chloroquine, hydroxychloroquine, steroids, some different types of, believe it or not, blood pressure pills, non-steroidal agents like Aleve, Advil. And unfortunately, to this point, nothing has really been proven to be effective against the virus. And so the main way we take care of patients if they get sick, is just what we call supportive care. And of course, you may have heard about the use of ventilators. And the ventilators are very important. Only a small percentage of people will get so sick that they need a ventilator. As you probably know, about 80% of people that get sick have mild illness, and those people would not need to be in a hospital. They would take care of themselves at home. About 20% of people will get what's called severe illness. That means they may have low oxygen levels, be short of breath, and would require hospitalization. And then out of that group, only a small percentage, about 2%, ultimately might end up in an ICU. And even for those that get very sick in the ICU, the good news is, and the reason you hear so much about ventilators, is that ventilators the use of them is life-saving for people with very severe pneumonia, what we call acute respiratory distress syndrome. And about 2/3 of people who get that sick would still be expected to survive. That's what the experience was in China, and that's the kind of experience we have, here in the United States with other kinds of severe pneumonias. People, the majority will actually survive if they get on a ventilator. So I think that's another thing to be aware of as far as what prognosis can be for people when they get sick. And then the last thing I want to say is just about the social distancing. I feel that people really should be keeping themselves at home, stay at home, don't leave unless it's essential for groceries or medicine. You've probably heard those guidelines. I do feel that countries like South Korea and China, who had the most success with controlling the spread of the virus, took very strict precautions. And now many of our governors, like Governor Baker, are encouraging people not to be out unless it's essential. And I think, ultimately the best way we're going to conquer this virus is by, continuing the social distancing, people staying at home so that they can't spread the virus from one to another. There's many other topics that we can discuss, and I'll be happy to take questions later, or I can give another short review of topics on my own if needed. Thank you very much.
Triffletti. He is a primary care physician and attending physician at Beth Israel Deaconess, and you can have your questions for all of our participants by emailing us at plymouthInfo@pactv.org. Dr. Triffletti is also a medical director at a skilled nursing facility, and our next guest is Danielle Fusco, and she is a regional clinical specialist with Plymouth Rehabilitation and Healthcare. Welcome, Danielle.
Thank you. Thank you for having me. I'm happy to report that as of today, we don't have any confirmed cases in Massachusetts. So certainly the safety of our residents and staff is primary. And we do follow the guidelines from both the CDC and the Department of Public Health. And we have been restricting our visitation since March 12th. And also providing screening. We have one entrance that our staff and vendors use, and all of our staff and vendors are required to fill out a health questionnaire, and also we take their temperature and oxygen saturation, O2 sat, on their way in. We're just looking for those subtle changes. We're looking for temps over 100, any sat less than 93%. With our residents, we are taking vital signs, Q shift, monitoring that, also looking for subtle changes that we would report to our physicians. We do have PPE available, and we're getting supplies in daily. And we just got a big supply in yesterday. So thus far, that hasn't been an issue for us. There's also a psychosocial aspect to this for our residents, and we're trying to keep them busy and keep the stress level down. And so, for instance, on a day like today, one of the activities is to go outside with the residents, let them get a breath of fresh air, keeping the social distancing 6 feet away from each other. We've had some hallway bingo and some other things. And of course, we're arranging meetings via Zoom, Skype with family and friends to keep them updated. And we have a weekly newsletter as well that's going out to families. We've had some window visits that have been successful. So really keeping the safety and security and keeping people well, so in spirit and in body and mind, is important. So those are just some of the measures that we've taken. But we do, as I said, CDC and DPH is where to get the most up-to-date information.
Thank you. That is Danielle Fusco. She'll be coming back once again. She is a regional clinical specialist with local nursing home, Plymouth Rehabilitation and Healthcare Center. We're now going to continue with our business component, and we're going to begin with Amy Naples, once again joining us as the Executive Director for the Plymouth Area Chamber of Commerce. Welcome, Amy. Amy is here.
Hello, sorry.
Yes.
Just wanted to make sure I was unmuted here. Thanks for having me, of course, again today. I just have a couple of quick updates to share with you. Each weekend, the Chamber hosts a cash mob, encouraging our community to support local business. All you have to do to support a local business is purchase online, order takeout, and post it on your Facebook page and tag the Chamber at Plymouth Area Chamber. We will randomly select a winner, and you'll receive a gift card from one of our amazing small businesses. The Chamber is also hosting a free webinar this coming Monday, March 30th at 10 a.m. Topics include the new CARES bill and SBA disaster loan forgiveness and tax credits for small businesses. It's facilitated by Erin Andrews of Stratline. And then the following Friday, next Friday, we'll be hosting another free webinar, Tips to Survive in a Down Economy, facilitated by Scott Hokinson and Kevin Hennessy of Braybo. And then next Wednesday at 10 a.m. and Thursday at 5 p.m., we have some open networking events for people to engage and collaborate. Certainly to learn more, you can visit us on our website, PlymouthChamber.com, and of course, follow us on Facebook. Thing I wanted to note, we've learned of so many people stepping up in our community to help our local small businesses. We can't thank you all enough for it. One I met from this show and quickly knew the Chamber should get behind what they were doing. So again, on the show today is local business owner Brian Fitzgibbons, and his team created a platform for area businesses to post their offering and hours for free, called the Order Local Project, and the site has certainly gained some traction. I'm excited to announce the Chamber has partnered with Brian, and we're looking forward to helping businesses in our community market their offerings, hours, and promos. During times like this, I think collaboration and partnerships are so important, and it's only going to make our community stronger. So I'll hand it over to Brian to tell you more about the project.
Thank you, Amy Naples, Executive Director of the Plymouth Area Chamber of Commerce. We're now going to Brian Fitzgibbons. He is of the Order Local Project. Welcome, Brian.
Hey, thank you, Steve, and thank you, Amy. Really grateful for the opportunity to have this platform here to speak about the Order Local Project today and talk a little bit about what we're doing to help out small businesses. My business, VenueX Media, specializes in digital advertising out of home. And obviously right now the out of home space is pretty quiet. So we redirected our efforts into some positive action here that we could take to help out small businesses in our town here in Plymouth. The Order Local Project is free for any businesses to use to list that they're, number one, that they're open throughout the crisis. Number two, to provide some information on the services that they're offering, whether it's a, buy one, get one pizza at Tavern on the Wharf, or it's a webinar that Straight Line or Braybo Payroll is running free to anybody to participate in. We are creating this crowdsourced effort to help small business in Plymouth get through this crisis. So what you could do is visit www.orderlocalproject.com. Again, if you're a business, we'll help you rebroadcast whatever messages that you're putting out on your social media feeds, and we'll provide that organized listing for any Plymouth businesses that and area businesses, Kingston, Duxbury. We've got businesses from all over listed on the site right now. And we're getting about 4,000 site visitors a day. So it's a great spot for local business to promote their products, to promote whatever it is they can provide right now during the crisis. And again, thank you, Amy. We're really excited to partner with the Chamber. We think that that's really important to connect with the community in that way, and we're excited about all the ways that we could hopefully help.
Thank you. That's Brian Fitzgibbons. He is with the Order Local Project, and at this time, we're going to go to our daily state update from State Representative Matthew Muratore. Welcome, Matt. One more time, Julie.
Sorry. You can hear me now?
We can hear you.
Can you hear me now?
Yes, we can.
Okay. Sorry. Okay. Just some quick updates. For the numbers so far, there's been 23,621 patients that have been tested, with 2,417 that have been tested positive, with 25 deaths, unfortunately, in Massachusetts at this point. In Plymouth County, we have 138 confirmed, and in Plymouth we have 13. Now, the governor has just finished a news conference before we got on, and we have a couple announcements that have come out of that. The state taxes are now delayed till July 15th, and that's what the federal government has done. So that is now in effect. There's also a travel guidance that's been issued. So anyone coming into Massachusetts beginning today are going to be asked to self-quarantine for 14 days. So that's traveling in through the borders from New Hampshire, from New York, from Connecticut, Rhode Island. Those will take effect as of today. And obviously that's to help slow down the process of the spread. In addition, there is a new tool, healthcare tool that folks can use. It's called Buoy Health. It's BUOY Health. And you can go on buoy.com/mass. Now, what this does, it's an online resource for residents to check their symptoms and then to connect with a healthcare resource person that can give you the next steps to do. This does not replace emergency medical care, but it will give you some quicker and faster information. So we do ask people to go on buoy.com/mass. And that is the update that I have for today, Steve.
Representative Matthew Muratore, we're going to be going to our questions in just a few minutes. And you can email us questions at plymouth.info@pactv.org. You can also check pactv.org for replays of today's presentation and the others that we've had. I'd also like to just let you know about tomorrow's lineup. In addition to Selectman Chair Kenneth Tavares and State Representative Matthew Muratore, we have Stephen Cole. He's the Executive Director for the Plymouth Regional Economic Foundation. Also, Dr. Barry Potvin is going to be joining us. He is a Plymouth Board of Health member, and Father John Cullity from St. Mary's Catholic Church here in North Plymouth. So we have a great lineup tomorrow as well. We're now going to go to our questions, and we're going to begin. The first question is for Melissa Arrighi, since we don't have anyone from the Board of Health or the Director of Public Health today. And Melissa, the question is, one of the viewers said that when they visit certain stores are practicing good social distancing, but some of them are not. And she wanted to know, what is the town of Plymouth doing in order to assure that all of the stores are practicing good social distancing?
Well, in our health department, we're more concentrating on restaurants and takeout and just advising stores. What I would recommend to residents, that if there are specific situations they see, that's when we can send somebody out, probably an inspector from our building department. As I think about it, we can send somebody out to do a spot check on the store. But right now, our concentration really is on the takeout places and what they have been doing, and having the health department do spot checks at those places. But any complaints, anything people see, we want to know about it, and that's when we can send someone there.
Thank you. Again, questions to plymouth.info@pactv.org. And our next question, we're going to go to Dr. Philip Triffletti, our primary care physician. First question for you, Dr. Phil, is a person contagious during the 5-day viral incubation period?
Thank you very much for that question. So during that 5-day incubation period, when I was talking earlier and I said in China, they believe that as many as 15 out of 100 patients might be shedding virus during that contagious period. The majority of people would not be shedding virus or would not be contagious until approximately 5 days. But there may be some shedding a virus. What typically happens in different types of respiratory infections is you might actually be shedding virus, but not contagious. In other words, the amount of virus that your body starts to produce is somewhat correlated with your symptoms. So as your symptoms intensify and you develop a fever and cough and all those types of symptoms, that's when the virus is replicating in your body at a much higher rate. And that's when you're most infectious or most dangerous or most contagious. So in general, you could consider, that first 5 days of incubation is probably not likely to pass the infection.
Thank you. We're going to go to State Representative Matthew Muratore. Representative Muratore, people have been asking in the past about what's being done for the homeless in Plymouth. Do you have any more information, Matt?
Yeah. Actually, Chairman Tavares and myself had a conversation with Connie from the Plymouth Homeless Coalition this morning. And we've also talked to Sheriff Joe McDonald. We're going to have a conference call this afternoon at 5 o'clock to see what we can do about there's about 25 or so that are in the shelter now. We're understanding the shelter will end on April 4th. So we're trying to work with Connie and her group and Father Bills to get some more definite answers of what we can do going forward. So more information will come out on that, I presume, by Monday. See why I have the mic open. Just a quick thing, just to address the question to Melissa about the stores. I also want to say that the governor has declared a major disaster declaration yesterday through the federal government, and also what he did yesterday is he's called on stores to make some changes to how they're actually servicing people. So I think, and then you'll see probably better today and probably the next day or two, some better ways that our stores in Plymouth will be dealing with the distancing and the other things that they need to do to comply.
Thank you, State Representative Matthew Muratore. You can email your questions to PlymouthInfo@PACTV.org. We'd like to go back to Dr. Phil. Question for you. The blood test for determining if a person has already had the virus, do they now have antibodies that are no longer contagious? I'm not quite sure if that question is understood, maybe by you.
I understand the question. Thank you very much. So the testing that we keep talking about is really what we would call, diagnostic testing to see if people have the virus. So that's the nasal swab is the most typical way of doing that. And with a type of testing called PCR, which stands for polymerase chain reaction, we can test to see if the virus particles are on the swab that came off the person. But that is really all we can do right now. We do not yet have the capability to do antibody testing, but we are trying to develop that capability. And I think as the weeks go on, I'm sure our scientific community and our medical community will eventually be able to look at antibody levels to tell who has been actually exposed and has mounted an immune reaction. But as of yet, we're not doing that.
Thank you. That's Dr. Philip Triffletti, a primary care physician with Beth Israel Deaconess. We've had a number of experts on this daily update. One of them in the past was also from the Plymouth Housing Authority. And today we have a question that I think can be handled by our town manager, Melissa Arrighi. And that question is, the viewer says that they have a family member living at the Cherry Hill Apartments, and they understand that currently no family members are allowed to visit residents in those apartments, and they want to know, is that enforceable? And specifically, they would like to be able to come at least to drop off food and medicine, even if they don't have any contact. They'd like to leave it outside the door of the family member. So the question really is, what can be done in order to not have the residents isolated so much that they can at least receive their basic needs and necessities? Melissa.
Yeah. So I hadn't heard that nobody was able to drop things off. It seems like essential items that the family would need. It's a good idea to be able to get those. So let me give while the show is going on, let me give the Housing Authority. I'll reach out to them right now.
Thank you very much. That's Melissa Arrighi. and she is our Plymouth Town Manager. If you have questions, you can email them to plymouthinfo at pactv.org. This is coming to you live on FiOS channel 47 and 43, Comcast channels 13 and 15. Your questions we will give to our participants as we do each day. And again, tomorrow we're going to be joined by Dr. Barry Potvin from the Plymouth Board of Health, as well as Father John Cullity from St. Mary's Catholic Church. And we're going to continue to go back. Do you have another question? We also have another question that just came in, and this is the question which says that it was mentioned that folks coming into Massachusetts from other states are being asked to self-quarantine for 14 days. Is this voluntary, and how is it going to be enforced? Matt Muratore, our state representative, I don't know if you want to take this.
I'd rather not.
Okay.
No, I'm just kidding. I'm just pulling it up now because the governor just announced this. So the travel advisory is it's a travel guidance, so that it's going to be difficult to enforce, but their messaging, the messaging boards will be out. There'll be pamphlets and information available at rest areas. The advisory is getting out. It'll be on social media. With all this, it's hard to be enforced. I mean, how do you force somebody to stay in for 14 days? But the encouragement of people to do this coming from other states and staying in 14 days will help alleviate the spread. And the quicker we can get through this, the better off we are. So we would hope that people would abide by the guidance of the governor's order to stay inside if you are coming from out of state for 14 days.
Yes, I do know of a couple. I haven't had contact with them, but I know that they have come out of state, and they did go to an Airbnb, and they imposed a self-quarantine for at least 14 days. Dr. Phil, I'm wondering if you can weigh in on the issue of self-quarantine. Is that something you would recommend, and is it warranted?
So self-quarantine is really referring to when we want to make sure a person is not infected and is not going to be contagious or spreading the virus amongst the community. And that, as I said earlier, that 14-day period, you would basically be covering people, even if they were, having the longest, possible period of contagiousness. That 14-day period would cover just about every person. While most people would probably only be contagious for 7 days, it adds a little extra level of security. But if I were to go beyond just the issue of self-quarantining, and of course, that's very important when also people might have been exposed to somebody with COVID-19, they would voluntarily self-quarantine. That's what I would tell patients if they thought they might have been exposed to somebody with COVID-19, self-quarantine for 14 days. I think that this recommendation by Governor Baker, I think, is excellent for people, coming from abroad outside the state borders. But if we go to the bigger issue, about how long should people be, keeping themselves away from others, whether you want to call it, quarantining or, stay at home or actually lock down. In my opinion, if you listen to the experts, and if we wanted to stop this virus from spreading, as I said previously, China and South Korea had very good success in stopping the virus from spreading. You would have the entire society basically just stop doing things, stay at home for a period of many weeks. And some experts think that would take at least 5 weeks if it was more of a strict, stay at home situation. So I think when you make decisions every day, as long as there still is some opportunity for mobility, you should really judge each time you venture out of the house, as an opportunity to either catch or spread the virus. And you should really determine if it's essential that you leave the house. Is it essential that you come in contact with another person? I mean, this is going to protect you as an individual by isolating yourself as much as possible, and it's going to protect the overall community as well. So my basic advice is, people should really stay at home as much as possible, do things remotely like we're doing here today. And the more that we isolate ourselves from each other, the quicker we'll get through this.
Thank you. That's Dr. Philip Triffletti. He's a primary care physician, Beth Israel Deaconess. Your questions can come to us at PlymouthInfo@PACTV.org. Each day we go back through our panel and give them another opportunity to give us their final thoughts and the message they'd like to leave us with. And before I do that, Melissa, do you have a response for that earlier viewer?
I'm sorry, I don't. I'm going to have to send that in to you.
Okay, so when we get that, we'll hear that. But in the meantime, Melissa, what would be something you'd want viewers to take away from today's update?
So some of the latest things that we're working on remotely, the town hall employees are on our better technology system up and operating as quickly as we can, because some of the biggest requests that we're receiving from the public is in regards to the building inspections, people that want to move into our home still. So we're working on that, even able to be able to do simple things that would help more with permitting and accepting credit cards online. So we're working on that now, hope to have that running up very soon. We are working, it's mostly our police chief and fire chief, as well as Karen Keene, our public health director, working closely with BID Plymouth. They're still looking at potential sites for a drive-up testing facility. That's ongoing. We should have news on that after a conference call we're having this upcoming Monday. And finally, just the message that we wanted to get out to the travelers from the governor's advisory. We'll be working on that this afternoon and should be able to post some information.
Thank you. That is Melissa Arrighi. She is Plymouth Town Manager. For those of you watching today's update, if some of our participants are using Wi-Fi, that sometimes causes the audio to not be as strong. We're going to Roxanne Whitbeck, who is here speaking to our veterans. Roxanne.
Hi. I just want to reiterate that even though our office is closed, our phone lines are still open. 508-747-1620, extension 10172 and 10173. Just leave a message. We'll get back in touch with you or via email, whichever way we can. And like I said, I put my cell phone out there earlier, 508-726-7456. Just give a call because we're right here. And, sometimes in these trying times, it's just good to hear a familiar voice to know that you're not out there alone. And we're right here with you guys. So hang in, everybody.
Thank you. That's Roxanne Whitbeck. She's the Veterans Agent for the town of Plymouth. We're going to circle around to all of our panel. Danielle Fusco, Regional Clinical Specialist. Your thoughts?
I'd just like to say that we're working really hard 24/7 to keep your loved ones safe. But please don't hesitate to call in if you have any questions. And also, we are updating our homepage daily, www.athenahealthcare.com. So, like I said, don't hesitate to reach out. And we're getting our daily updates and implementing strategies to keep everyone safe.
Thank you. That's Danielle Fusco. She's with Plymouth Rehabilitation and Healthcare Center. Amy Naples from the Plymouth Area Chamber of Commerce.
Hi. So this weekend, as we practice social distancing, remember there are still ways that you can support your local business and community. Purchase gift cards online, get takeout, follow your favorite small business on Facebook, and say thank you to the essential employees still working, especially our police, fire, and healthcare workers, because we are all staying safe and we are stronger because of them. So distance socially and support locally.
Amy Naples, Plymouth Area Chamber of Commerce, joined by Brian Fitzgibbons from the Order Local Project. Brian, your thoughts?
Thanks, Steve. Last thought here is, echoing what Amy said. Keep supporting local businesses. Keep taking action to help your neighbors and your community around you. And the small ways that Amy and I are talking about together that you can do that is by buying gift cards, by ordering out curbside pickup, from local businesses in Plymouth. You can find a lot of those listings on orderlocalproject.com. And we'd encourage you to subscribe and like the Facebook page so you can receive those notifications.
Thank you, Brian Fitzgibbons of the Order Local Project. We're going to go back to Dr. Philip Triffletti. Phil, our Plymouth community is watching. What can you tell our viewers that will be helpful to them as they are trying to respond to the COVID-19?
Yes, I have 3 more topics I just want to cover quickly. The first thing would be, what do I do if I get sick? That question comes up, quite a bit. And as I talked about earlier, most people are just going to have mild illness. And I think it's always important, if you have a primary care physician, to contact them and you can review what symptoms you have. But what you should expect is that if you have mild illness, you would just stay at home, you would self-quarantine yourself, and that would be for 14 days, and you would try to self-isolate yourself from others in the home. For people that have more severe illness, what would that be? Well, that would be people can't breathe, they're short of breath, they're vomiting, they can't stop vomiting. Those, if they were to call me and I was trying to decide who should go to the hospital to be seen and possibly need to be admitted to the hospital and treated, it would be those kinds of patients. So people that have a fever and a cough and other things, if the symptoms are manageable at home, they would stay at home. But if they were to call somebody like me or make a decision on their own what to do, it would really be for more severe symptoms like I can't breathe or I can't stop vomiting, something of that nature. A lot of people, I'm sure, wonder about getting tested. And of course, our testing capacity continues to improve. But I can tell you at our main campus in Boston, we're still prioritizing testing. So most of the test kits are being reserved for either healthcare workers who have developed symptoms that we're concerned about, or for testing of our severely ill patients. And so again, patients who have those mild symptoms that I discussed in general, until we have widespread availability of testing kits, most of the mild illness people at this point might not be getting tested. I found it almost impossible to get patients with mild symptoms tested, but I do think that will improve over time and will become an important strategy later on as the epidemic slows down and we can go back to what's called containment practices. The testing of patients with symptoms, even mild symptoms, will be more important to isolate them from others and to prevent recurrence of the spread of the infection. And then the last thing I want to come back to is just this whole principle of the social distancing. I've been asked, why is this virus so contagious? Well, it turns out, influenza, a person who gets influenza would probably infect about 2 to 3 other people. That's about the same data we're getting now on COVID-19, a respiratory illness that's spread very much similar to influenza. The average person who gets infected probably infects about 2 or 3 more people. The problem with the new virus is that it's a brand new virus we've never been exposed to before. In a typical year in the United States, about 10% of us would get influenza. And the reason it's not 20 or 30% of us getting influenza is that we have a vaccine and about half the population takes the vaccine. Some people also already have immunity because they may have been exposed to that flu strain in previous years. So there's a lot more protection against general influenza. This new virus, there's no protection. None of our immune systems have been exposed to this before. It's brand new. So that's why we think it could ultimately infect. Some experts think, 40 to 60% of us could ultimately get this infection. That would be similar to what would happen with influenza if we didn't have these other protections in place with vaccines, et cetera. And then, of course, the biggest problem is influenza only kills about 1 in 1,000 people, which is still, it's not a good number, and we take all precautions every year to try to prevent deaths from influenza. But the problem with the COVID-19 is it's probably about 20 times more deadly than influenza. It probably kills more like 2 in 100. So if you were to estimate that ultimately, say, a third of our country were to get this COVID-19, that could be over 100 million people. And if 2% of those people died, that would be like 2 million deaths. So really what we're trying to accomplish with all this work on social distancing is, this whole principle of flattening the curve is we don't want to get to that point where we end up having 2 million people die in the United States from COVID-19. We want to keep that number as small as possible. So that's why I urge people to really, take the social distancing very, very seriously. And we have to the more we do up front, the more we'll save lives on the back end. And so I wish you all well. Stay at home, stay safe, and be well.
Thank you. That's Dr. Philip Triffletti. He is a primary care physician and attending physician at Beth Israel Deaconess. And now we're going to go to State Representative Matthew Muratore. Your final thoughts.
Yeah, thank you, Steve. I do have a answer to that question on the housing. Russ Shirley, who is an elected board member of the housing, just texted me. And they are taking the directions from the Department of Housing and Community Development. So they are following those guidelines. They're not restricted unless they have been exposed or have symptoms. However, social visits are discouraged for obvious reasons. We all should be practicing social distancing. And the common areas at Cherry Hill are closed. And this is all posted there. So I hope that clarifies that question for the viewer. In closing today, the one thing I want to bring up a couple things I want to bring up to the high school kids and college kids who are home. There is still a need for elderly folks out in the community that do need some support, do need some help, do need help going to the grocery store. So if you are in a neighborhood that you have some elderly people, please check on them. Please offer to go to the grocery stores with them. We've had a number of high school kids and college students I've heard of that are helping with services for childcare for kids in the neighborhood. So we really continue to appreciate that. With regard to childcare, there are two more open in Plymouth. So Plymouth now has 5 childcare emergency drop-off centers open now. So that was good as well. One thing for the younger kids to do, elementary school kids and maybe middle school kids, the Plymouth 400 is having an art contest. And so they're going to be posting that on social media. So it might be a time where folks have a lot of downtime, kids have a lot of downtime. They may want to take a look at this and participate in this art contest that'll be going through the end of June. So be on the lookout for that. And finally, just want to remind folks about where you can get information from the state on the COVID-19. You can call 211. You can get a text to you on any alerts that are coming up by going to 888-777 and type in COVID-MA, or you can do mass.gov/COVID-19. And the last thank you goes to all of folks that have been participating on a daily basis with you and I and Ken, getting the information out to the community. I'm getting a lot of great feedback that people are really appreciating the information that's being given to them. We really want to thank our, as Amy said, our first responders, our healthcare workers, daycare workers, grocery store folks. These people are real heroes. They're on the front lines and they are working on our behalf. So we owe them a great deal of gratitude and appreciation. So let's continue to show that to all those folks. And finally, my daily plea from the governor is Red Cross. The Red Cross that needs blood desperately. So please go on the redcrossblood.org. And if you have the time that you can sign up for giving blood, please do so. And that's my update today.
Thank you, State Representative Matthew Muratore. Our questions are still coming in to PlymouthInfo@PACTV.org. If we can go back to Dr. Philip Triffletti, one more quick question. Dr. Phil, if you get COVID-19, can you get it again or are you one and done?
Great question. And of course, the experts don't really know the answer to this for sure, but I would expect more than likely you would not get it again. But, we don't really have good data on this yet, and answers will be forthcoming in the future, but we're hopeful that you'll only get it once.
Thank you. That's Dr. Philip Triffletti, primary care physician, attending physician, Beth Israel Deaconess. We first began these daily updates 2 weeks ago tomorrow. And following that, Selectman Chair Ken Tavares encouraged PACTV and me to continue with him in providing these updates, which we've now gone daily 6 days a week, Monday through Saturday. Once again, Selectman Chair Kenneth Tavares, your final thoughts for today.
Thank you, Steve. We recognize that so much information is being given to the residents of our community, and it may seem exhausting at times to take this, process it through your own head and see how it's going to impact your family. Our advice is catch your breath, listen to what's being said, and we know that it's different and a little more difficult to do things. As an example, our today is actually bringing food into the house for the first time in 2 weeks. We were very fortunate to find a vendor, actually it's Quintal's Produce, that you can call in an order, pull up, have it already paid for, and it'll be put into your trunk. I thought, well, that's fairly easy, but the next part is a little more difficult. We're being asked now to clean that food before we put it away, and there's a great illustration of how to do this on YouTube. So we encourage people to follow the directions, follow the guidelines. The quicker we do this and the more faithful we are to it, we will overcome this virus. But it's going to take, as I've said so many times before, it's going to take all of us working together. We can do it. We can do it. And we'll see you tomorrow. Thank you.
Thank you. That is Kenneth Tavares. He is the chair of the Plymouth Board of Selectmen. We want to thank PACTV, Julie Thompson, and all of her staff that have been here every day. This is our 10th update that we've been doing. I want to thank today's participants, along with Selectman Chair Ken Tavares and Matt Muratore. Today we were joined by Melissa Arrighi, our Plymouth Town Manager, Roxanne Whitbeck, the Plymouth Veterans Agent, Dr. Philip Triffletti from Beth Israel Deaconess, Danielle Fusco, Regional Clinical Specialist from Plymouth Rehab and Healthcare Center, Amy Naples from the Plymouth Area Chamber of Commerce, Brian Fitzgibbons from the Order Local Project, and joining us tomorrow, we will also hear from Stephen Cole, Executive Director, Plymouth Regional Economic Foundation, Dr. Barry Potvin, he is the Plymouth Board of Health member, and finally, Father John Cullity from St. Mary's Catholic Church. I'd like to thank all of you for joining us, and good day. I'm Steve Triffletti, Plymouth Town Moderator. Please join us tomorrow. Thank you.